Greetings, it's New Zealand naturopath Eric Bakker. Thanks for checking out my video. I'm going to talk again about toenail fungus, about yeast infection of the toenail. A condition I see quite a lot in people. So I've got a list here of about 8 or 9 different conditions that people commonly mistaken for toenail yeast infection or toenail fungus. So let's go through this list. I'll give you a bit of commentary and explain a bit more as I go along. So these are common conditions that people have or may have, and they may actually think that they've got a toenail yeast infection when in fact they haven't got that at all. So the first one would be lines and ridges on nails. We commonly see these with patients who come in to see a naturopath or a medical doctor. Lines and ridges can be formed for many different reasons. There are certain lines called Bowes lines, for example, small white long ridges along the nail. Those lines can be caused sometimes by particularly, I find, problems with the stomach. So poor stomach acidity, which can preclude somebody from absorbing the minerals they need to build good nails. So nails are made of keratin, of protein. To be able to build good nails, you have to break down protein properly to peptides, polypeptides and amino acids that help to build nail tissue. You've got to be able to absorb the right kinds of minerals and vitamins that allow good nail structure and this matrix to build. So with poor digestion is poor nail function. All right, and with increasing age, we see this commonly in older people. People taking acid-blocking medication, for example, will have a lot of lines or ridges. People who drink a lot of alcohol, like spirits, on an empty stomach can get these ridges. And another condition I commonly associate with underfunctioning gut often will be a redness of the cheek or fine capillaries around this area. You'll see that often in people in their my age, 50s or 60s, particularly whiskey drinkers or vodka drinkers or cigarette smokers. They'll often wreck their gut function, and they'll start developing these capillaries and ridged nails, and these are common things. White spots on the nails or white flecks can be a sign of deficiencies of iron or zinc. Various macro minerals, so bigger minerals, or trace element deficiencies will manifest as specks, flecks, or these weird spots on nails. So that's lines and ridges. I associate a nail with a little hump on the, with a nail shaped in a sort of hump shape, often to be an issue with blood pressure and particularly respiratory problems with the patient. So chronic lung conditions like COPD, chronic obstructive pulmonary disorder, for example, or emphysema, a person can have a nail that's in a bit of a hump shape. Okay, so look at a person who's got emphysema at their fingernails, and you'll see this to be true. Certain lung cancers will create this problem as well. The second one is senile nails or old nails. So elderly people often have very brittle nails and thin nails, particularly at the edge of the nail. This is not a yeast infection. This generally means poor digestion. With each passing decade, the person's digestive system will just go down and down and down. And as a consequence, they'll also have poor bone, poor nerve, poor muscle, poor hair. Everything declines as the person ages. If you can revive an elderly person's digestive system, you're going to do them a lot of good. And I often like to put elderly patients for that reason on betaine hydrochloric acid, betaine HCl and pepsin, digestive enzymes, which can give them a whole new lease of life. Third one, white or yellow nails. Okay, this can be a separation of the nail bed. So you may get a bit of air under the nail in this case. Yellowing nails with a smoker are quite common. You'll see that often on these two fingers, the index finger and the middle finger from holding the cigarette. So if you get yellowing on nails with smoker, well, it'll be the nicotine, the tar contributing to that. But if you've got a yellowing or whitening of the nail, it could be the nail lifting. And that can also be the occupation of the person. They could have their hands wet or be in gloves quite a lot. I've seen patients working on dairy farms, for example, that have a lot of moisture on their hands or in gloves that tend to get this yellowing of the nail. This is not necessarily a fungal infection. Sometimes the best thing to do is to get a scraping taken from under the fingernail and get this checked out to make sure, it's a yeast infection or not. Particularly if a person's working in an environment like that where you're not quite sure what you're dealing with. Red or black nails, hematoma. I mean, we've all had hematoma from time to time. Have you ever had, you ever struck your finger with a hammer or a blunt, heavy object and had that excruciating pain? There's a lot of nerves. The fingers are rich in nerves, so if you hit a nail, it's going to hurt like hell. And over time, over a period of 2 or 3 days, you're going to get a swelling under the nail, pressure building up, and sometimes lancing that nail with a hot needle, and you'll get a spurt of black blood coming out. So that's called a hematoma. It's basically a blood bruise trapped under a nail. And you'll sometimes see people in your day-to-day life with black nails. Often trauma was involved. So ask the person, and you'll find usually that they dropped something on it, or it was a car door accident, or they could be a carpenter or builder. These are common things with males, but we see them with females quite a lot as well. Green nails. So nails can also be susceptible to bacterial infection, and there's one called Pseudomonas. Pseudomonas can affect people on different levels: lungs, their blood, but also their nails. Pseudomonas infections can be quite critical if they're internal, but they're usually quite limiting if they're external on the nail. So the nail bed may be infected with bacteria, and this can manifest itself as a greeny coloured nail. Pretty weird, okay? But yeah, get that one checked out if you're in doubt as well. Pitted nails. Pitted nails are quite common with psoriasis. 3/4 of psoriasis patients have got a Candida yeast infection, and I believe that all psoriasis patients should be treated for yeast infection. Check out my psoriasis program, thepsoriasisprogram.com. There's a good website on psoriasis information. But pitted nails warrant usually treatment for fungal nails, in my opinion. So if you've got nail it's got like little pits in it or dots, treat as you would a toenail fungus condition. Swelling of the red area of skin around the nail. Paronychia, or paronchia. There are different ways you can pronounce this. Paronchia. So this is basically a little infection, at the bottom of the nail there where the cuticle is. You can get a bacterial infection there, and that can cause a painful red inflammation, of that area. Whitlow's is another condition. Whitlow, it's a condition really involving the fingertip, like a little infection right at the edge of the finger with the fingernail. So quite similar again. These are little infections, and often they occur from cutting the nail too short, or cutting into the cuticle, or damaging the cuticle. So with proper nail care and pushing the cuticle back, good clean habits, you're going to prevent things like the swelling occurring in these areas. And the last one really is chronic nail trauma. So nail trauma we see in people in certain occupations. I've seen people from all walks of life over the last 27 years in my clinic. People working in roadworks, carpenters, welders, boilermakers, plumbers, all these sorts of people, but even jewelers. Many people who use their hands quite a lot can be prone to nail trauma, but it can also happen just to moms and dads and children, falling off a bicycle, working in the garden. There are many areas that can make you more prone to getting nail damage. I tend to wear gloves all the time when I'm in the garden. I do a lot of work around the house, painting and carpentry work, but I always wear a good set of gloves. I've got many different kinds of gloves I wear depending on the job that I'm doing. But even if I mow the yard, mow the garden and rake leaves, I tend to wear just cheap sort of cotton gloves. I find it quite a good idea because it prevents a lot of damage to the fingers and to the skin. Because hands, if you damage them, it can be a portal of entry of bacteria. And it can also make it more difficult for you to work on computers, mobile devices. So I hope that gives you a bit of information on the 8 common things, some common, some less common, that could be misconstrued as a toenail, or fingernail fungal condition. Because we do get fungal conditions of the toenail and the fingernail. More commonly, the toenail fungus affects the feet, but you can get, fungus affecting the fingernails as well. Thanks for tuning into my video today.